Hello, my name is John Kozadowski, and this is a speech about dying. Everybody dies. You will die, and I will die. For some, death is quick and painless, but for others, death is a painful, slow process that can take weeks, months, or even years. For these people, palliative care, or hospice care, is a care that is intended to improve comfort and minimize suffering. According to Judith Gordon, a board member for an organization called End of Life Washington, depression and anxiety run rampant in the terminally ill. Understandably so. However, a number of studies have shown that psilocybin can address and ease a wide range of psychological issues faced by the terminally ill. Today, I'm going to talk to you about the historical legality of psilocybin mushrooms, the results of a study on the use of psilocybin in terminally ill cancer patients, and what these results could mean for the potential use of psilocybin in palliative care. First off, what is psilocybin? Psilocybin is described by the Hefter Institute, a leading researcher into psychedelics, as acting on the brain's serotonin receptors to increase or change one's state of consciousness, and it can be found in certain mushrooms. Psilocybin mushrooms are currently found on the Drug Enforcement Agency's Schedule I drug list and have been since the creation of the drug scheduling lists by the ratification of the Controlled Substances Act in 1970. These substances are defined by the DEA as having no currently applicable medical use and a high potential for abuse. Just for context, heroin, methamphetamine, and cocaine are also found on the Schedule I drug list. What does this mean? This means that federally, psilocybin mushrooms are illegal. And with the exception of a few places, this is true on a state-to-state basis as well. This being said, the Food and Drug Administration has recently begun to approve clinical trials involving psilocybin. One such study conducted by Roland Griffiths and his team at Johns Hopkins University investigated the effects of psilocybin mushrooms on terminally ill cancer patients. This study was conducted over the course of months, with patients attending multiple intake and introductory sessions leading up to their actual psilocybin therapy session. This was then followed by weekly and monthly check-ins. The results were overwhelmingly positive, with 80% reporting improvements in well-being and satisfaction. Notably, there were 0 reports of any adverse side effects. Even in follow-up sessions 6 months after a single dose of psilocybin, 78% of patients reported reduced depression and 83% reported reduced anxiety, which is just incredible. So, what does this mean for psilocybin's potential use in palliative care? To understand this, it's important to understand the goals of organizations like End of Life Washington. End of Life Washington is an organization that is committed to death with dignity. In other words, they aim to increase autonomy and treatment options for palliative care patients and people at the end of their life. In a policy statement and review, Judith Gordon, on behalf of End of Life Washington, advocates for the accessibility of psilocybin mushrooms for terminally ill patients on the basis of study results like the ones collected by Roland Griffiths. She states, quote, "Studies show that psilocybin therapy is effective in relieving emotional distress and existential distress at the end of life for 65 to 85% of terminally ill people in clinical trials when it's administered properly. There are no lasting negative effects and many significant and enduring positive benefits. These findings fit with the goals of palliative care." End quote. Additionally, Anthony Bosis, the director of palliative care and a lead investigator at the New York University's Psilocybin Cancer Anxiety Project, weighed in on the potential for psilocybin to be used in palliative care in an interview with Psychology Today. He compared the limited options for treating anxiety and depression with psilocybin treatments by saying this: "The major tools that psychiatry and medicine have to treat anxiety and depression are antidepressants and anti-anxiety agents, which only work temporarily while the drug's in your system. With these psychedelic medicines, there's a complete paradigm shift. It's not about the drug per se in the end, but this change in consciousness that allows for a few hours these incredible experiences and insights to be gleaned, and that's what changes them. We'll see how long it works for, but for months on end, these people are changed. End quote. Today, I spoke about the historical legality of psilocybin mushrooms, the results of clinical trials and studies, and the impact these results could have on the use of psilocybin in palliative care. The study into the fields of alternative medicine is ever expanding. End-of-life care is something that can deeply impact all of us, because after all, we're all going to die. And it's important to understand, promote, and keep an open mind about a variety of treatment options. Thank you.